Lord Lieutenant, ladies and gentlemen, good morning. It's always a risk following the Lord Lieutenant and then your deputy leader that you don't cover the same ground as Ian did. We did actually agree scripting, didn't we? So Ian broadly hasn't said the things that I'm going to say, so thank you, Ian, for that. I will reinforce one or two key points that Ian made, but I'll try and cover some different ground and give a different perspective. As you can see, I'm Head of Policy and Partnerships at the County Council. Within that, I lead upon all things voluntary sector, so I take a lead on our voluntary sector issues and spend a huge amount of my time talking to colleagues from the voluntary community sector, formally and informally, to very much hopefully kind of understand what the issues are, take those back into the organisation and think about how we can work better together. So I very much support Ian as the Cabinet member with responsibility for all those things to what our strategy is with you. I also lead on our localities agenda that again Ian is the Cabinet lead for, so I can give you a flavour of some of the things that we're trying to do around locality working, which as Ian said is going to be the future about how we work in localities with communities and with you to deliver the kind of outcomes that we need in the future. Just one final thing to say is my preamble. I'm very much a friend of the sector. It's probably been 10 years or so now that Staffordshire and in a former life in Greater Manchester that I've worked very heavily with the voluntary sector. So I get you, I understand the value that you bring, and I think the collection of shots that we've just seen illustrates exactly the richness and value of the voluntary community sector. As Ian said, our challenge is to harness all of your value along with that from the private sector and the public sector to get the very best possible solutions for the people of Stoke-on-Trent and Staffordshire. So I have a few slides, some of which you've already seen on the screen, but hopefully you couldn't read them. I'm not going to dwell on this and talk you through it, but I think it is quite important just to kind of frame where, I guess, Ian and I are coming from. That's our strategy that we've had now for a couple of years or so, that very much articulates what we're about as an organisation, but equally what we're about as a partnership. Whilst the wording might be slightly different, all partners across the Staffordshire Strategic Partnership are about jobs and growth, helping people to live independently in good health and well-being, and how we make communities safer and happier. So everybody signed up to that. I guess as Ian said, our collective challenge is how do we make that real on the ground and have a really big impact on the lives of people at Staffordshire and Stoke-on-Trent. And just to reinforce a couple of points that Ian made, we can only achieve that in partnership by working with you and others. And I think we do that kind of really well in Staffordshire and Stoke-on-Trent, but we need to redouble our efforts. But increasingly within communities and within localities. And again, I'll say a little bit more about that. So just to reinforce the fact that that's great that we have an agreed strategy that we're all focusing upon, but our challenge is to deliver that in the future. Ian's touched on some of this, so I won't kind of cover it all, but just to bring a bit of additional colour and flavour to that. The really good news is the economy is growing, as Ian said. I think when you look at the numbers, as you can imagine that I do from time to time, over the last kind of 6 years, there have been over 10,000 new jobs created in Staffordshire and Stoke-on-Trent, which is great and clearly good news. And if we get our investment strategies right for the future, we've got potentially £500 million worth of investment in infrastructure, economic development and employment and skills that hopefully, with a fair wind, will create 22,000 new jobs over the coming years. So huge success and a huge foundation to build upon. I think our collective challenge is A, to deliver that, but actually how do we make sure that increasing amounts of local people benefit from those new jobs and that prosperity. So there's a really big challenge around skills that I'll touch on later on, and there's a really important role for the sector in shaping that. Ian's mentioned austerity, I won't touch on that in great detail. Just this demand issue around children, families and older people, as Ian said, the system is fractured, it's under huge kind of financial pressure, and we have lots of people who we're trying to support with intensive requirements and needs. We need to fix that and make that system sustainable. But increasingly, I think our collective challenge is to think about what do we do before people enter those systems to support people to live good lives in the first place. Early intervention, prevention, demand management, community-based preventative work, all of those things that we all talk about a lot, and we can point to many really good examples of that on the ground that you're involved in leading and delivering. I think our challenge is how we scale that up and do it as part of an overall approach that we all sign up to, and I'll say a little bit more about that later on. As Ian said, the election is looming and too close to call. and that will bring what it will bring. The additional point I make that Ian didn't touch upon is you'll have picked up the debate now that's got some momentum around this thing called devolution and decentralisation. We can see it happening in parts of the country, Scotland, Greater Manchester, one or two shire areas getting some additional powers from government. I think our take on that, and I'm sure Ian would reinforce this, is there shouldn't be a clamour to establish a combined authority in Staffordshire and Stoke-on-Trent. We shouldn't kind of follow the pack to chase the gold. What we need to do is redouble our efforts about working in partnership locally, be very clear about what our strategy is for Staffordshire and Stoke-on-Trent, and focus on delivering that. If we get that bit right, then even when a devolution offer comes from government, we'll be in a really, really strong position to articulate what we're about and what we require from government to help us deliver our local priorities. So I think that's the principle where we're starting from as a county council with our partners, but not to turn our minds against it, because I think our sense is that the discussion around devolution and decentralisation will continue into the life of the next Parliament, but let's not get too distracted by that in the short term, because there's a job of work to be done. Just, I guess, to frame, so that's the context that Ian and I have articulated. So what are we trying to do with it? And again, Ian touched on some of this, but I'll have slightly more colour and flavour, I guess, as one of the officers, senior levels, trying to support Ian and the Cabinet and other colleagues to try and shape that. So the jobs will come, hopefully, when we deliver that programme, but how do we make sure that our school improves, that parents get more involved in challenging schools to improve, and how do we drive up the level of skills that we've got across the county and the city to make sure that increasing amounts of local people can benefit from that new prosperity. That's a big challenge for us that we're making good inroads into. Our average attainment rates at schools now are above the national average, but our skills rates at a high level still lag behind the national average. So work in progress, but work to be done absolutely around how we drive up education attainment and skills to maximise the local benefits. Ian's mentioned the challenges around health and social care. It's no accepted wisdom that integration is the order of the day. When you look at the 5-year forward review from the NHS published recently, that's all about local areas collaborating together and coming up with more integrated models of health and social care. We're beginning to get our minds around that locally. You'll know we're a distressed health economy. We know we've got major pressures in the system, and we need to work with our health colleagues to try and fix the system. But at the same time, think about what we do locally to help people live independently and keep them away from expensive and acute services in the first place. There is absolutely something, I think, around being razor sharp around our approach to early intervention and prevention. We know the nature of the people that are in the system, whether it be people with health and social care needs, criminal justice system, mental health, learning disabilities, children and young people. We know who they are, and therefore we should be able to predict what their needs and issues are and how we can better support them. And where the next flow of people with those conditions might come from. Our collective challenge is to get upstream and try and predict those issues in the first place. And for those people who don't need to be in those expensive systems, what can we do on the ground within communities to build upon the good work that predominantly you do in the voluntary community sector to better support people within their communities. We're beginning to think through how we do that, but it's very much early thinking, and we'll need to talk to you and other people about how we do that. And then there's a thing called joining up and targeting our resources. And I think we've got some way to go on that. We talk about integrated commissioning. As Ian said, there's still in the range of £7.2 billion worth of public sector investment in the system. That's not counting the capacity that you bring in the voluntary sector and in the private sector. So there's something around how we make the best use of that total resource locally, how we join up our commissioning approaches across the public sector, get our commissioners working more effectively together. Talking with one or two people at the marketplace earlier on today, who I know, a real sense that we do still sometimes commission in silos. Commissioners with their professional interest do things in a certain way. They're not bad people, it's just the way sometimes the system works. So we need to work with our partners and with you to try and have a much more joined up approach to how we use that resource and commission based on outcomes. And then absolutely that's true at the locality level as well. We've come some way, I think, over the last 2 or 3 years to develop a stronger locality model. I now manage the district commissioning leads who are very much around trying to knit together what happens locally. But I think we need to go much further than that and think about how we join up our commissioning intentions locally, use that resource more effectively, and think about what are the particular issues and needs in each locality, and how do we find different and creative ways of finding solutions to that, by working openly with you and other people locally. So I think there's a direction of travel there which has been good, but we need to kick on and do much more of that in the future, and that's certainly a key priority for Ian and I. So a little bit specifically about you. I think there's something around what we need to get our heads around as I guess as a commissioner, is the fact that you wear at least 3 hats, all of which are legitimate and valid. On the one hand, you're a key partner who work with us shoulder to shoulder to commission for outcomes and help us with our commissioning, thinking and decisions. But at times you will, and rightly so, be a critical friend. You will advocate for sometimes the most vulnerable people and challenge us quite hard around some of the things that we do, and that's legitimate. And very often you're a provider as well. And I think you operate in all 3 spaces, and we need to accept the fact that you do and find ways of engaging you early with our thinking as trusted partners, whilst at the same time recognising that there might be a procurement process at some point, and we need to kind of respect both. And I think we can find a way through that. One of the big things that people tell me all the time is it would be great if you could engage us earlier in your initial decisions and discussions around what you might want to do and buy. And I can see examples of where we've done that really well with our partners, but equally I think there are times when we do that less well, and not just the County Council but all of our partners. So there is something around when we're beginning to get our minds around what's the commissioning question as a commissioning organisation, about how we find ways of engaging you informally to help us with our thinking, so that we don't start to design the wrong solution which we then bring to the market. So that's work in progress, I think, again. I think we've done quite a lot of work to improve our commissioning processes, but again, one of the things that people tell me all the time is they still feel quite heavy sometimes for the voluntary sector. It would be great to have 3-year arrangements where possible. It would be great to have standardised processes if we can. It would be great for that to be shared across the public sector. So I think there's a messaging there which I think we are responding to, but I think that's an ongoing priority for us and the commissioners to make sure that we get that right in the future, to frankly not exclude you from that marketplace. And then I think this is a really important point, because I think we often fall into this kind of mindset of, well, there's a commissioner and provider relationship here, which I think there very often is. But I think if we're going to find some of those more creative delivery models and approaches, then it may well be that whether it isn't a commissioner-provider relationship, it's about setting up some kind of joint venture or social enterprise together or special purpose vehicle. And there are many examples of those different models across the city and the county already, so I think it's about being alive to the fact that it can and should probably look different in the future, and we as commissioners need to open our mind to that and work with you constructively to do that. My final slide, and hopefully I'm not run over the 15 minutes I was allocated by Peter, I said I wouldn't. So, and I've touched on some of this already, but what might be the big strategic stuff then that we're thinking through as a county council with our partners that we certainly need to engage with you on? You'll be aware that we've just done the 2nd round of locality commissioning locally. Quite significant resources now being passported down to localities to commission for outcomes in a more integrated way. I think that's good and gone well, and is one important element of what we need to do. I think my 2 observations from that are, it's actually about understanding which of those projects locally are having the greatest impact. So we need to do some really strong evaluation around the stuff that people have been commissioned to do. Because if they are good and they work, there's a question around why can't we scale it up and do it elsewhere to help to keep people live independently in good health. We also need to think about how we get the processes right. So there's an evaluation that we're doing and also FAST are doing to reflect upon how that worked in this 2nd year, to think about when we do it in the future, we improve the way that we procure and commission that. There's this point around how we enable people to live at home. There's a crisis in the NHS and within social care, as Ian talked about, which we need to kind of grapple with and resolve. But actually we need to make sure that we spend time thinking about what's that piece around early intervention and prevention, whether it be for children, families, older people. And there's a huge amount of evidence around what works, and there'll be huge amounts of good practice locally within each of our communities as well. And you will have your thoughts about how we can do that differently and better. And I was talking with a number of colleagues before the conference started about some ideas they've got. We need to find a way of bottling that, I think, and making that the norm as part of a community-based approach in Staffordshire and Stoke-on-Trent as part of what we do in the future. I'll finish on building better opportunities. It was flashed up as a slide a couple of times about the work that we're doing around building better opportunities, and I can see David Gibson, my colleague in the room as well, who's leading all that work. So if you want some money, go and talk to David. And Judith, hello Judith. So as my slide said, there's a huge amount of investment that's going to take place in the future around economic development, infrastructure, employment and skills. A big chunk of that is around employment and skills, and you'll be aware that hopefully £25 million worth of that European funding and the lottery funding is targeted towards the voluntary community sector, and particularly trying to help those people who are furthest away from work to understand what barriers they've got to learning and how we can support them back towards or into employment. We've got a really big opportunity to kind of redesign our approach to that employment and skills offer to those vulnerable and often socially excluded people. And we've got time to do that over the coming months to build the kind of the 6-year programme in the future. So there's a really big opportunity there that we need to work on with you. So hopefully that's given you a sense, I guess, of our context as a county council, some of our strategy for the future, and I think some of the kind of challenges and priorities that we need to work on with you. Thank you for the opportunity to speak. I'm around all day, so I'm sure I'll have to take some questions on my panel later on. But happy to follow on with anything I've talked about during the rest of the conference. So thank you very much indeed.